a communique at the end of a 2-day workshop on improving primary health care services in Nigeria and the challenges of global health as contained in the 2019 Goalkeepers report of the Bill and Melinda Gates Foundation by the Coalition of PACFA at Scale Advocates. Now our observations. We, the Coalition of Advocates, under the Partnership for Advocacy in Child and Family Health at Scale, PACFA at Scale, met for 2 days to review the report on global positions of healthcare delivery, climate adaptation, gender inequality, digital inclusion, and data exploration. All these are challenges bedeviling global health, peace, economic growth, and development. In Nigeria, as the federal government prepares to submit the 2020 budget, which is a document that affects everybody, we want to use this opportunity to draw the attention of the federal government to one of the greatest challenges facing the attainment of the universal health coverage in our dear country, the full implementation of primary healthcare policy in Nigeria. This policy is facing fragmented and multiple structures as a result of lack of an effective governance system for primary health care at state and local government levels nationwide. The weak capacity of local governments responsible for primary health care delivery is resulting in poor quality of services provided to the people in primary health care facilities across the country. The systemic weaknesses due to gaps ranging from infrastructural decay, inadequacy in human resources, non-availability of essential equipment, essential medicines and consumables, and other supplies. Other challenges facing the implementation of the policy still are difficulty in translating primary healthcare plans, programs, and activities into action, resulting in poor health outcomes. Efficiency. Here, the state primary healthcare boards / agencies across the country provide oversight of all primary healthcare activities delivered by local government areas and partners. This reduces duplication, wastage, and improves efficient use of resources to achieve better health outcomes. Quality of health services. We observed here that primary healthcare under one roof program promotes equity and increased access to affordable, high-quality basic healthcare services to all, especially for the poor and vulnerable at the grassroots, towards the attainment of the universal health coverage. On transparency and accountability, we note that with clearly defined roles and responsibility, it is easier for the governors, local government chairmen, commissioners of health, and other stakeholders to know who to hold accountable for primary service delivery at all levels. Access to more funding. We believe here that by enhancing eligibility for additional funding, such as the Basic Healthcare Provision Fund, which is a fund set aside by the federal government for state to access, and other national and international partners, international funding for PHC services. There is also non-establishment of local government health authorities by states. And then part of the challenges also is the delayed movement of PHC programs, staff, and funds from state ministries of health to state primary healthcare development agencies nationwide. There is also the problem of inadequate capacity building for primary healthcare boards on primary healthcare under one roof implementation. There is also key requirements for primary healthcare under one roof implementation at state and sub-state levels that are not captured in the state primary healthcare development agencies laws. We also note poor dissemination of relevant documents and materials on the implementation of the primary healthcare under one roof, and above all, there is poor funding of primary healthcare development boards by state governments and local governments across the country. These are the things we observe that we see as problems in the primary healthcare delivery system in the country. And it is based upon these observations that we hereby make the following recommendations. 1. Prioritize technical support to primary healthcare development agencies/boards to erect solid pillars to house primary healthcare under one roof and to improve performance on critical pillars like minimum service package, repositioning human resources, and sustainable funding. We also recommend, for the assistance of the primary healthcare development agencies/boards to establish functional local government health authorities for all local governments in the country. We also call on the federal government and other partners to disseminate the reviewed primary healthcare under one roof implementation guidelines and other documents to guide the state primary healthcare development agencies team at state levels. We also want a kind of increase in advocacy to state governments to support the state primary healthcare boards to fully implement the primary healthcare under one roof program. In addition to what I have said, it's like Oliver Twist, we continue to ask for more. We want the adoption of the primary healthcare under one roof policy and apply guidelines for implementation at state and local government levels. We also seek the needed assistance from the National Primary Healthcare Development Agency and partners here to achieve these set objectives. We also call for the establishment of functional local government health authorities. You may observe at the federal level, we have the National Primary Healthcare Development Agency. At state levels, we have the state primary healthcare development agencies or state primary healthcare development boards. But at the local government level, we have no any structure existing at the moment as far primary healthcare is concerned. And we also encourage states across the country to exchange visits among themselves so that they can share experiences and learn lessons from one another. Definitely one state may be performing much better than the other, and if the visits are exchanged, they can learn lessons, and at the end of the day, we see improvement in primary healthcare delivery across the states and the 774 local governments across the country. And it is our belief at the end of the day that if these observations we've made and the recommendations are implemented across the 3 tiers of governments we have in the country, Nigeria's quest for health for all and the universal health coverage target will be achieved in this country. And finally, the last but not the least, though I presented him right at the onset of the briefing, I would still want to use this opportunity to congratulate one of us, Mr. Tonyet Michael Otu, for winning the 2019 Goalkeepers Award. The Goalkeepers Award is an award by the Bill and Melinda Gates Foundation for extraordinary work in promoting humanity across the globe. So, gentlemen of the press, thank you for honoring our invitation. The floor is now open for you. Thank you very much.